good evening. I was just thinking about the proposal for the hospital development as well as revenue generation for our hospital. Uh, when I was thinking of this yesterday night, I was thinking that I'll have to look at it from three angles. One is a patient's angle, very, very important. Second is from the doctor's angle, and the third is from the management's angle. So, first, I would like to, I'm just giving a broad outline of the various hospitals where I have worked in, the deficiencies which I've seen consistently happening, which have affected the hospitals, not only the revenue part, but also the name of the hospitals and the various things going wrong, which often go unnoticed. So, I'm giving a broad outline as such, and only after knowing the facilities and the renovations and other things that are being done in a hospital, probably later on we can take it from there, probably one step at a time. I feel that the most important this thing is patient satisfaction. This is lacking in most hospitals. What happens is a patient comes to the hospital in the reception. The reception, they're kept waiting, and patients don't want to be left unattended to. They need to be shown that they are important. This everyone knows, but still it doesn't happen because it is somebody else who is doing this part. The most important area in a hospital, I feel, is the reception. There, people should immediately attend to a patient, make him comfortable. If he is supposed to wait, he should be explained the reason why he has to wait politely, and probably the PRO or someone give him a bottle of water, some newspapers, magazines. It is there in most of the hospitals. But going and handing it over is different. Rather than asking him to sit and then tell that the doctor will be there, he will be looking. Because what happens is, if they are dissatisfied in the reception, whether it is in the outpatient after seeing a doctor, or if they have been admitted and inside the hospital, there will be a lot of complaints for minor issues. Trivial issues will become a big issue for them, they'll make it a bigger issue. So, this has to be kept in mind, and the reception people have to ensure that the patients are attended to, they are satisfied, and things go smoothly. One. The second thing is that I have observed even recently of late, a patient is brought into the emergency, a huge crowd comes there with them, and all of them are crowded in the emergency, and no one is able to push them. There should be someone to tell them. I have done it myself. I have told, please go and be seated in the reception, because it will affect the treatment. You are going to disturb the doctor. He has to diagnose, he has to treat. So, please be seated and we will keep you aware. One person closely related to the patient should be allowed inside. That is natural, it happens, because he has to give the history, the details, and things. And these people should also be kept occasionally attended to. So, this prevents confusion in the emergency room, because a confusion in the reception can affect all the other patients who are sitting and can carry negative vibes regarding the hospital. So, this I feel is very important. And subsequently, when we look at the revenue generation part, it starts with the registration charges. I feel that a slight increase in the registration charges, giving a smart card if possible, because it carries the whole details of the patient rather than the regular OP book which a patient carries. Most of them I have seen they carry it home. A registration, this thing carrying all the details, so that whenever the patient comes, next time, there is no necessity for them to undergo the whole process again. So, this is one thing, registration charges first time, and subsequently you can look at reducing the, whether that is left to the management regarding registration charges, whether to claim it a second time, third time when they come in, or whatever. Then the consultation charges. This is something which I would stress upon. It's very, very important because I have observed even recently. What happens is a satisfied patient goes out paying how much ever, even if they are not well to do. If they are satisfied with a doctor's explanation, his treatment, his way of this thing, they don't mind paying. So the charges could be different for various doctors. See, I don't want to name the hospital. One of the hospitals, a patient with cough, congestion had come without even examining the patient, had written and given and sent them. The patient was out grumbling. He's charging 400, 350, 400 rupees, didn't even check. So this is something which has to be looked into. And ideally, we need to have a fresh doctor who is fairly knowledgeable in diverting the patient to whichever consultant. After registration, straight to a duty doctor should know where to send the patient to, whether to a physician or any case, a cardiac case, definitely it goes to an emergency, cardiac emergency, or whether to a gynecologist, abdominal pain, whether to a physician, whether it is probably a surgical issue, that the duty doctor should be able to discriminate and then send. So no time lost. And here again, the duty doctor should not give his diagnosis as final, because when the patient goes to the consultant, if he says something else, they get disturbed. I'll come to it later on. Because the discrepancies between doctors talking differently, it happens very often, confuses the patient's relatives and creates commotion. That is very important when you look at that. So the consultation charges should be based on the doctor's experience. See, if I as a doctor, if I am free with the patient, talk to him well, explain to him examine him well, explain to him about the disease, explain about the medication which he is taking, and of course the art of medicine comes into play. Because we can't tell all the side effects. For example, for statins, if I say to an 80-year-old lady, if there are any cramps or pain, you get back. Next day she'll be back, because there will be all aches and pains at this age. So I got to probably talk to a relative and tell, undue leg pain or cramps, you get back. So that is the art of medicine. And if this explanation regarding everything is given, and the patient when going out should be satisfied, that patient will definitely pay 300 or 400, 500 very easily. They don't grumble. Whereas the doctor just writes a few medicines and then looks at him and sends, then naturally you can't charge that much. So it should be different for different. I'm talking about revenue generation here. Here again, the doctor's part is very, very important, because when I tell investigations, I have to explain to the patient why these investigations are necessary. I've got to probably tell him that if a 40-year-old man comes, I would say that, see, it is ideal that you have a menstrual checkup, because of various diseases going unnoticed. We would like to know before people develop problems, cholesterol, pre-diabetes, pre-hypertension. So all this, probably a fatty liver indicates pre-diabetes. So all this we'll get to know, so that the patient is clear. So when the results come and all are normal, the patient will not say, I've been unnecessarily made to take this. Likewise for a CT scan or an MRI, once they are explained. I recently had a patient telling my headache, and then the reason for the headache I found out was one of the relatives of this patient had a brain tumor. And for this patient, I realized said that, see, you are paranoid. So you better go through an MRI. Because until this is proven, you are not going to be all right. You are going to be hopping doctors. So when we explain that we are taking tests either for confirming a diagnosis or to confirm to the patient that there is no problem, then that patient is satisfied. He happily pays and goes. So this part I feel is very important. So that has to be looked into, because this helps a lot in revenue generation and preventing complications and patients going around and talking about the hospital and telling, when you get into this place, they'll start charging you like anything. They will do all investigations, unnecessary things. The reasons are because they are not explained properly. That is one thing I feel which should be looked very well into. And the master health checkups can be of various degrees. It can be a basic master health checkup, or for the jobs and all that, they've got a different protocol. It can be an executive health checkup, but there should be someone explaining all this before the doctor sees. And I personally feel with the master health checkup, there should be an opthal consultation, a dental consultation, and a gynec consultation. Eventually, the patient goes to the physician, and the physician decides whether the patient requires any super specialty consultation or further investigations, and explains why these investigations are necessary. And when you look at the patient, you are sure, you are clear that they are satisfied, they are going to go about it and going to do it. So that I feel is very, very important. That is why I feel that doctor's role is very important in not only revenue generation, but also in maintaining the hospital's name and taking it further. Not only his own name. And the other area will be to ensure that the pharmacy is definitely a main part in a hospital for revenue generation. I've seen recent past the pharmacies, patients complaining that I've seen the doctor, I waited for half an hour, it doesn't matter, finished, I have gone. But in the pharmacy, I have to wait for 1 hour. They leave the hospital, go outside and buy the medicines. I had even suggested that keep one sector for the outpatients, one for the inpatients, so that there is no backlog, there is no waiting for the patients. Be polite to them. Very important is being polite. A smile and then tell them, please. They listen. When you grumble, I have got a lot of work to do. They are naturally irritated. No one wants to come to a hospital, and things start going wrong. So this has to be looked into. And the pharmaceutical companies, where the medicines are got, what the benefit is there for the hospital and all, is for the management to decide, sitting along with the doctor whom they trust or a board. So this is something which is very, very important. Then the other part I'd like to stress upon, which I have been doing and doing successfully, is patient education. Patient education, patients, when they are seated in the reception, they start grumbling. They are waiting, even if it is, see, I personally, for my patients, I go out and tell, sir, it will take half an hour. Why don't you just go out, have a cup of coffee, or have your tiffin and come? It is going to take time. Then they are happy. They say, okay, sir, it doesn't matter. But then when they are just made to sit like that and they keep on waiting and no one tells anything in front of a doctor's consultation room, they get agitated, they start grumbling, it goes to the other person, other patient starts telling his problems, these start going outside. These are the things which we don't want in the hospital. So there should be somebody telling, ideally the doctor talking to his patients, coming into the consultation room, telling that I'll take 20 minutes for each patient. Probably for one patient I'll take more, please understand. That levels out things very easily. So that is very important, and ideally educative videos, I feel, is a must and has been implemented and proven to be very effective in the reception. Talking about, for example, anemia, the commonest cause of anemia in patient's language, in Tamil, commonest cause, worms. Worms are the commonest cause, so you need to deworm yourself. Sudden drop in hemoglobin, you'll have to look at other causes, which you talk to your doctor, he will explain. Probably piles is an important cause. Like that, educative videos would be very helpful in patients they are kept interested when they are sitting in the reception, and it is like in front of a cardiologist room, you talk about angina, you talk about heartburn. When you're talking about these, I would say that probably pain, anginal pain is a pain around here, probably going to the arm or to the jaw, or spreading to the fingers. Typical anginal pain. Don't ignore, but don't be afraid at the same time. First, this thing is find out whether the commonest cause of most chest pains are epigastric spasm. That is the esophageal spasm, reflex. So don't get worried when you get a thing, because the adrenal rush makes it worse. So explaining to them in this way, but don't ignore. So this sort of educative videos not only keeps the patient, but they also is very important. Patient education is lacking in our country, especially chronic diseases. I've been trying to do this through videos and webinars to patients. They need to know a person with diabetes, person with hypertension. These are the problems which are going to lead to long-term complications. A sudden heart attack or a renal failure or a cerebral hemorrhage or an infarct causes our diabetes, hypertension most commonly. Talk about hypothyroidism. A gynecologist can talk about PCOD and other things, causes of menorrhagia, and in front of a room there can be a video and the patients in the reception are kept aware without frightening them, explaining them the superficial symptoms so that the doctor's work is also reduced when the patients come inside. So that is another way of probably attracting patients. This is very important rather than showing all the news and the cinema serials and other things. I feel that this is very important because matters concerned to the patient's health, they will listen. They will be interested and they won't mind spending time and they will not grumble. So this is another thing which will draw patients back to the hospital, back to the doctor. And it becomes easier for the interreferral between doctors. This is something which is very important. I've seen in most hospitals that what happens is the referral goes outside. So the referral should be inside, and we should be having doctors round the clock. I'm sorry to say that most hospitals employ doctors who are not cleared the Indian exam from Philippines, other places. They are not aware. Sometimes I am afraid leaving my patient in the hospital in the middle of the night, something goes wrong, they don't know what to do. So I always talk to the ICU thing and tell that if there is anything, just have a look at this patient so that I can be peaceful. So that sort of things have to be taken into consideration. So interreferral should be justified also. So when I am referring to another consultant, I should explain to the patient the need for my referral there, and the other doctor takes care of. And also, I'll also come to the other this thing, basic masteral checkups. Masteral checkups, I feel that somebody should accompany the patients. I have seen in most hospitals patients not knowing where to go. This department, another department, they are left alone, or they are taken and suddenly the PRO disappears. Elderly people, they need to be taken care of. So that is important. And then the explanation goes finally into the doctor's hands. So the patient educative classes, I've been doing it successfully. Probably every Saturday, 1 hour, we get all the patients' relatives and then talk to them about common disorders like diabetes. It is a vascular problem. It's a disease of the blood vessels. It is not just about lowering sugar, and the disease can lead to other issues like major cardiac, other issues. That is the reason why we are treating. The medication given, talk to your doctor if you have got doubts. Sit down, write your doubts when you are going to the doctor, when you are seated outside. Clear everything and then go out. It is the patient's right, doctor-patient relationship. It's the patient's right to ask their doubts. But they should not be too elaborate also, that the doctor knows how to manage. It's all very simple, and say and then push it off. And it is the doctor's responsibility to respond to these queries. So I feel that the patient satisfaction plays a big role not only in the hospital development but revenue generation also. Suppose I am writing a drug which is 70 rupees. I explain to the patient that this is how the drug works. It is a monopoly drug, but you need it. I tell them that cut off 1 or 2 cups of coffee. You have 2 drinks at night, cut it off. When you tell in front of the relatives, they naturally understand. They ensure that the medication is taken. Not only the drug is bought, but the medication should be taken also. So the onus falls on the doctors. So it is very important as to the consultants who are there in the hospital. They have to be clear. And this is something which I'll touch upon later. I'm sorry I'm not boring you, but these are important issues I feel I've been looking at in the 33 years of my practice. And when you come to the billing, billing section is this thing where I feel that the patients are always made to wait. They're given a bill, but they're not given the breakups. So when the patient is getting discharged, they have to be clearly told 3 o'clock. By then, everything will be ready. Everything should be ready, including breakups. So we should not let patients come and ask for the breakups. Clear it up then and there, so that they are satisfied and they are going. And I always tell patients that if you have got any queries, any deficiencies you find, any problems, address it right then and there. Don't go out and talk about it. Clear it there. There should be a person, a troubleshooter, who should look into this and clear off all the patient issues right then. Or explain to them. There are patients who are bent upon on creating trouble. Basically, they want concession, they want reduction. So we know the troubleshooter should be the one who should be able to understand this and explain to the management. There should be the administration people to handle such people. And billing is one thing, and then discounts. I feel in the pharmacy, in most of the hospitals, they don't give discounts. So the patients go online. I can't tell a patient that don't buy online. It is not proper on my part. They give 15-20% discount. But if a 5% discount is given for regular patients buying from the hospital pharmacy, 5%, a card is given. They also know they have to come to the doctor every month or something like that. They definitely would prefer buying it rather than going out for a 20% discount. Some might, but that is inevitable. But you can ensure that the number of people going out are much reduced. They get it from our pharmacy. So this is important. 5%, 10%, that is for the management to decide. And ideally, 3 brands of each drug, which the management prefers, probably a doctor prefers, doctor gives his reasons for preferring this. That is also important. So all this, the doctor-management relationship has to be good. So there needs to be a regular communication between the doctors, regular doctors in the hospital and the management, so that they are all in the same tune. And camps are one thing which I have seen, that going and doing camps 20, 30, 40 kilometers away, I feel that it is not worthwhile. You can do probably as service, but you cannot expect them to come to our hospital. Ideally, camps should be conducted inside the hospital so that the footfall increases. They get to see the hospital, they get to see the facilities, they get to see the consultants. If required, then and there the referrals can be made. So, ideally, I feel not too much of camps, 1 or 2, alternating, depending on the consultant. Talk to the consultant, find out the convenience, have camps done, and then this charge nominally for the camps. We can use the medical companies to do. I've done it as far myself. Getting the thyroid function test done for 50 rupees for the patient, the hospital gets 50 rupees from that. Or something like that can be worked out by the administration. It is very important that the person in administration is in the same tune as the doctor, or made to be in that. And marketing is a very important aspect, where you look at the doctors around. I mean, there again, what to say, the referral charges, everything goes. That's for the management to decide. Doctors prefer. But there is one thing which is very important, is in giving admitting rights. Admitting rights should not be given to every doctor. I have seen issues even recently. A doctor comes in, not that competent, sorry to say this, but then he interferes with the treatment goes wrong, and then the hospital is blamed. So admitting rights should be given very carefully. In that, the medical superintendent or the senior doctor should play a role in deciding on this. And they can, of course, see their patients. That is different. That is a delicate thing which has to be discussed with the management. Because doctors, there are people referring, there are, even non-medical people referring regularly for the referral charges alone, coming and trying to dictate. I have seen a non-medical person in a voluntary organization calling up the sisters and telling, start normal saline, ringer lactate. All this should not be encouraged, should not happen. So they should be kept in their place and then taken care of, and then and there, not allowed to talk about their things and think in front of the patients or in the reception. Very important. And the other thing is, I've always seen that in many of the hospitals, patients are taken out of the hospital. Even before, when I was at SRM, I've had a duty doctor once calling me and telling, "Sir, I had sent for a CT abdomen. This lab is not giving me referral charges." I said, "What are you talking about? You're talking as if it is your right. A patient coming into the hospital, whatever benefits the labs or whatever give, they should go to the hospital. It is different for a private patient. One private patient, their own patient comes. It is a delicate thing which has to be clarified, because I've seen that patients coming regularly for 2 years to the hospital, the doctor says it is my patient. It is not that. Patient has first come to the hospital, then become your patient. So you can't say that it is my patient and start doing all tests and taking referral charges. That should not be allowed, whoever the doctor is. That is one thing which is very important. And then taking patients away from the hospital keeps happening. Patients ask whether do you consult outside. It means that they are not comfortable with the hospital. I have asked them, what is the problem with the coming here, waiting, the other things here. The reception don't respond properly. Reception people should keep in touch with patients very often. Those who have sent, suppose I say come after a month, they should call them up and find out how they are and tell that your appointment is for tomorrow. So all these things play a very important role. Then the rest of the things depends on the facilities in the hospital, what we are providing, and this can be looked into later on. And one more thing I would like to emphasize is that it is very important during this pandemic, we can't expect sudden surge of patients or sudden increase in revenue, because patients are afraid to come to the hospital. Even today I had 2 patients calling with symptoms of COVID. They don't want to go to a hospital. It is a very awkward thing for a doctor. They feel that they'll be admitted, and it has been happening unfortunately with minimal symptoms. A youngster who can be quarantined being admitted and then charged 30,000-40,000 per day. People know. We think that they don't know, but we have to realize that patients do know most things and go along with that and then see. So we can't expect a sudden surge or increase in the revenue at the earliest. It will take time, especially with this pandemic. And it is very important for doctors. Probably one thing we can do is start on video consultations through the hospital, not direct to the doctor. Doctor will take away the patient, most of them. So ideally, patients coming, you have to meet a doctor. Doctor is not there, we will arrange a video consultation with a doctor. Here again, there are difficulties, because unless you examine a patient first time and then see, there is a difference between just viewing him, talking to him, and then treating him. It is okay for rather minor cases, but for issues like a cardiac problem, to listen to a murmur or increased heart rate or something, it will not work. The patients have to come to the hospital, which during the video consultation the doctor will say, and all the protection should be provided. Ideally, I suggest that a glass panel, like in banks, which will tell us between a doctor and those things, so that the doctors are protected. I'm seeing many doctors in the hospitals where I work falling sick, and then you find that there are no replacements. You always have a replacement substitute for every consultant, so that they don't feel that they are numero uno, no one else. If I am not there, there's nobody else. That should not happen. So there should be this thing. And again, I want to stress on this point. I've seen the ICUs. The ICU in charge tells something to the relatives. A neurologist or a cardiologist come and then they go out and tell something else contradictory. This should be avoided. It's very, very important. I've seen patients getting confused, even my own relatives. Even my patients, when I admit into the ICU, I go in, see, and tell the ICU consultant, this is what I'm going to tell the relatives. That's slightly better. The ICU in charge will explain, and I tell them the reason also. Why? Because if I tell something slightly out of the way, you'll get confused. It is natural. So just follow. I trust him. So just listen to him. Things should go well. So there should be no contradictory statements between doctors. I'm telling all this because these all eventually reflect on the hospital, the status of the hospital as well as the name, whatever, name, fame, whatever, and eventually the revenue generation. Naturally, footfall will increase. So I think I've broadly covered. I thought it was in this rains, inclement weather. Don't know when I'll get an appointment to speak with. Other things can be taken forward, and of course we can have various things like what we have started in the other hospital, hypertension clinic 2 days a week, evenings or sometime, allergy clinic twice a week, a diabetic clinic. Of course, diabetes is an epidemic now. It is the most commonest thing which is being missed also. Pre-diabetic screening, very, very important. That happens regularly in the mornings. And then the tests that go with that, explaining that, all these can be looked into. So I feel, sir, that I have covered most of the things broadly. Rest of the things can be addressed gradually as we proceed. So I do hope that we meet sometime and then decide on how we go about it. Thank you so much. Have a nice day.